And next up, we have a terrific company, a terrific platform that's seeing success in ways that on the digital health infrastructure side, we talked about yesterday in the summit, this digital health reset taking place in the ecosystem. And a part of that reset is the connectivity. We saw in the 1980s, the community health information networks. We saw in the 1990s, the CHIMIS programs, the community health information management systems, and that built again a little bit more of what we're seeing. We saw RIOs develop with Bush 2 in 2004 and the Bush 2 administration, the regional health information organizations, and those accelerated a little bit with Obama's the Affordable Care Act. And so these platforms that kind of connect clinical data with claims data, radiological data with script data, and all of the different essences of these data repositories has been growing in the US little by little. And HITLAB has found a platform recently called Myelith. And this platform takes that to a level we've never seen before. Out of all the different iterations of connectivity platforms out there, the Myelith platform is by far the most advanced we've seen, not just in terms of the data architecture, but in terms of the data visualization on the front end. And so we're thrilled to be able to introduce to you all Hari Makkala, who comes from, he's Silicon Valley based, and he has a company, Myelith, that is not a piece of PowerPoint deck or a vaporware, but it's actually been deployed in a few different health plans. It's growing rapidly, and we thought you'd like to know about it because we're really excited about it. So usually that's what our community wants to know about. And again, the idea here is that Hari has a little bit of the evidence of what's being adopted with his platform, and we'll make a presentation here today. Hari, the virtual podium is yours.
Thank you, Stan. Thank you for the opportunity. Stan, can I share my screen? Yeah. Okay. Hello, everyone. I would like to share some information about our company and what we are doing, and especially how we are leveraging blockchain and AI in healthcare. I know that blockchain gets a lot of bad reputation with things that are happening in fintech, but I would like to spend some time sharing about how we are exploiting blockchain and bringing the good of healthcare. So we're a San Francisco-based company. We are focused on solving major problems in healthcare, leveraging blockchain technology. And our focus has been optimizing healthcare by lowering healthcare costs and administrative costs. We have a great team that we assembled. They bring close to 135 years of collective experience in healthcare, business, and technology, especially from more large organizations leading transformations across complex, large and complex transformation across large organizations. And by the way, we do have some excellent partnerships that we have established with Oracle, Onyx, and a few other companies. And we are engaged in doing some joint marketing strategies as well. Our mission is to transform healthcare, leveraging blockchain technology, again, to lower healthcare spending, reduce administrative costs, and to deliver high-value care for consumers, payers, employers, providers, and actually adding any other stakeholders because of what you could do with blockchain and distributed ledger technologies. The problem that we are focused on, if you look at from a healthcare perspective, the healthcare spending is on the rise and has been on the rise. And primary contributors are medical prices. And even though there is a significant variation of medical prices in the marketplace, and the other major contributor is the administrative cost, which is close to $950 billion and 25% of the total healthcare spend. And primary contributors to that are lack of transparency and difficult to navigate healthcare systems. So how is it react? What is the impact in the industry? So close to 203% of growth over the last decade on average deductible. 52% of the consumers cannot afford their deductibles today. and they are requiring 77% of consumers that were surveyed would like to see some kind of price transparency. We talked about 25% of healthcare spend is on administrative waste, and 75% of payers and providers businesses are expected to use value-based healthcare model by 2023 to 2025. So the solution that we developed, leveraging distributed ledger technology and AI, we're simplifying the clinical, administrative, and payment processing. We've enabled trusted collaborations across stakeholders so that we can build new digital experiences and collaboration. We developed pre-built use cases so that we're trying to take away the complexity of blockchain technology and making it easy for payers and providers to leverage it, along with the pre-built integrations and interoperability. And finally, we're empowering consumers and giving them incentives to make their healthcare while they're making their healthcare decisions, leveraging these technologies. Our product is very modular, as you could see. We've enabled a number of use cases, leveraging core architecture principles of distributed ledger technology and using AI. We are very judicious about what we store on blockchain, and we actually use both private and public blockchain in an integrated fashion, along with AI, to bring these different modules, from a product perspective. And our focus remains on consumer engagement, provider efficiencies, solving Cures Act compliance, healthcare workflow improvement, and value-based healthcare services. The technology that we are using, we are one of the first organizations in healthcare to leverage Web 3.0 to optimize healthcare workflow. As an example, we enabled claims workflow, which essentially we demonstrated that end-to-end workflow could be achieved in less than 12 seconds. But of course, that's not very realistic in the marketplace. But we enabled the technologies to increase the speed significantly compared to the 30 to 60 days it takes today. We're leveraging cloud native and also using multi-cloud architecture to bring the solutions. We integrated public and private blockchain network, and also we are 100% API enabled with also providing mobile and web portals for consumers, providers, and payers. And we're leveraging AI capabilities where possible, along with digital, distributed ledger technology. And finally, we are completely FHIR and HIPAA EDI-based standards that we are using in our transactions. And by the way, we are HIPAA certified and ONC HIT certified for storing electronic health records on our platform. Here is a high-level market size for the problems that we see. Our focus is on payers, providers, employers, and consumers. From a size perspective, where we can help healthcare lower spending. Just with 10% lower in prices, the market size is around $128 billion. But we know that the medical prices vary anywhere from 40% to, in some cases, 160%. And secondly, $265 billion in cost savings opportunity from administrative simplification. So the total addressable market that we see is around $60 billion for our solutions. The value proposition, as we mentioned about the optimizing healthcare revenue cycle, we've developed a solution that could go from real time to again, the limitation there is what a payer would like to implement. So we can make it exponentially faster, bring transparency, and all of that for almost the cost 5 times lower than today's cost. Another one is the longitudinal health records. This is where we are empowering consumers to store longitudinal health records on our platform at no cost. Accuracy of price and quality transparency. We are using current payer and provider negotiated fees and quality metrics to bring that information and value to deliver new products for employers and employees. And finally, the interoperability, enabling value-based healthcare services and meeting Cures Act compliance for a fraction of cost. Here is our business model. Again, we're focused on selling services to providers, hospitals, and doctors. Our SaaS platform supports health insurance payers, employers, and then we partner heavily with technology partners to bring a PaaS solution and services. So with that, if you have any questions, I would be happy to go.
Yeah, that's really, really impressive. And, when we start looking at these solutions, and as our community certainly understands, they are really overly complex. And what your platform does is very nicely simplify it, not just in terms of the data there, but also the accessibility of the data, the visual display of the data. And that's helpful, that not just for the patient is that helpful, but it's also helpful for the folks that are working on the back end as they're administering and implementing it as well. Which are one of the major factors we found in our research over the last 3 years that are really providing obstacles to implementation. Is that when teams look at implementation and the complexity of that, when it gets too complicated, they'll take a pass. And the nice thing about what you're doing is it's not that complicated. Really well done. And let's just look through the chat box for Q&A and see what we have here as well around this. We've got a couple of minutes left, and certainly would love to take any questions. If you have any questions, again, feel free to connect with me on LinkedIn and throw it through there, or pop it in the chat box here as well. And here's someone who runs a clinic in New York, and their name is Milton, and they're looking at trying to put together something like this, and they're wondering what are some of the major opportunities that you're seeing to implement this. So he's talking about the implementation as well. So when you are implementing this with your customers, is it a 1 month, 2 month implementation timeframe? What's it looking like?
Thanks, Dan. The implementation is looking like anywhere from 1 to 3 or 4 months, depending upon the complexity of the problem. We do have traction, especially in the Cures Act compliance area, and we are seeing some new opportunities in both value-based healthcare services, as well as some of the Medicaid and Medicare plans that are looking to implement new portals and also new collaboration models, especially with member and provider portals for the future.
That's really helpful. And then one last quick question, if you can answer it in a minute or so. What are some of the barriers that you're encountering when you're telling people and socializing this idea of ledger technology?
Yeah, especially with some of the challenges that the fintech has provided from a public perception perspective. We do, there is interest. I mean, we had to explain like how we are not using the cryptocurrency that changes value. Instead, we use stable tokens to improve the financial transactions, making financial transactions seamless for healthcare payers and providers. So we are all about improving optimization and have nothing to do with changing the value of cryptocurrency, and also bringing the value of distributed ledger technology to enable healthcare optimization of their workflows.
It's fantastic.
It does take a little work, but I think people are recognizing the advantages, and we are able to demonstrate in a practical sense So that makes a big difference. So, and we are able to fit into their ecosystem while we're leveraging that.
Love it. Congratulations on that. That's massive. And again, thank you for joining us here today. And Hari, have a great rest of the week. We'll talk to you soon. Take care.
Thank you. Thanks for the opportunity.
So again, just another element of this digital health infrastructure that we're seeing coming into the ecosystem during the digital health reset. And so a lot of these were organizations that were developed even pre-COVID, accelerated during COVID. And now with the funding coming back to, but higher than 2019 levels, not as high as 2020, 2021, we're seeing these business models and these value creation models in healthcare taking hold, and they're developing. And it's very interesting to see the different value points that they do create.